everyone, to another episode of Recharging the Human Battery. I'm Dr. Stefano. I'm joined by my co-host, Mandi Dickey, who's been doing a lot of these on her own recently, as I'm pulled in about 20,000 different directions. But I missed you guys, wanted to get back in the studio and get it going here on AM 950 radio. And, before these shows, it's not like we sit around and and have, whiteboard sessions and stuff like that. We just like to bring you, topics that may help you and your families. And one of the things that really bothers me, it's a pet peeve as a physician that sees a lot of people that are in a lot of pain, is that the level of misunderstanding and confusion around this topic of pain management is really putting people in a difficult situation. And one of the things that bothers me is that there are so many things to do as physicians, as nurse practitioners, any providers you see, your chiropractor, whoever you're seeing, there's so many things that can be offered to you way in advance of where I'm seeing people. And to be honest with you, I'm getting pretty sick and tired, literally, of seeing people that are on these crazy advanced pain regimens that absolutely don't need to be. There is a place for getting really, really aggressive, with pain, especially with the medications and with some of these like higher level procedures. And for some people, it's honestly a game changer. It's a lifesaver. But we are skipping so many steps. I don't know if because we just don't have the time to really sit down with people and say, hey, you could do this, you could do that. If it's people that just don't want to do it, they want to take the easy button and just take that pill or sign up for whatever when they've skipped about 19 other things that they can do. But it's a huge problem, and it's really led to, in our country, and this is estimated, and this is low. I'll just tell you what's estimated by the CDC. About 20% of adults right now are suffering from chronic pain. That means they've suffered from the same type of pain for at least 3 months or more. And then if you look at the big ones, back pain, neck pain, headaches, right? Total body pain, fibromyalgia, neuropathic pain. They have pain, just pain, like peripheral neuropathies that become painful. It's a big problem. Does it bother you that people are just put on crazy regimens and they really haven't been talked to about everything that's available that can realistically help them with their pain?
Yeah, I think there's a big gap because a lot of providers don't know what all of the options are, so they don't offer them. And when patients come in and ask questions, we've talked about this before on the show, they kind of poo-poo it. No, I don't know anything about that. And they just stick to what they know. The problem is when you stick to what you know, you're putting people in this negative cycle that they're always going to need that because that's what you've started them on. And if you're not giving them other options, it's going to be really difficult to get them off of that.
And I mean, and it's really frustrating because it all starts with just lifestyle changes that can make a humongous difference, in people's pain. But again, that takes them making an investment in themselves. And I'm talking about not even a financial investment, just an investment in time and motivation and all these other things. And we'll just go through, again, this isn't medical advice. This is just, I'm trying to give you guys guidelines. Mandy's trying to give you guidelines because it's not right. And the people are getting more and more ill and they're more and more in pain. Just to give you, before we kind of get into it, like really get into it, just to get what you just said. We had a patient that we were treating with a class 4 laser who was doing great. And we've talked about class 4 laser. We talk about it a little bit on the other side, but we have a lot to cover. Went back to his orthopedic surgeon and said, hey, I'm doing this class 4 laser. It's great. And his advice was, well, you don't need to go to that clinic. You could just get the same thing on Amazon. This is where we're at. You can get that piece of equipment that, list price is like $80-something thousand. You can get that on Amazon, except you can't because it's a regulated device that needs medical supervision. This is what and this is a person that's saying they have an improvement. So on the other side of the break, we'll dive into some of these topics. We'll see you back on AM 950. This is Recharging the Human Battery. recharging the human battery, actually. And we're recharging the human radio. So we're just knocking out everything today simultaneously. I'm here with Mandi Dickey. I'm Dr. Sinacropi. We're on AM 950 radio. And today we're talking about something that we both deal with our patient population, constantly. And so, just to throw in an example, the other day I saw 30 patients in the clinic. And we had patients coming from all over the place. And so, there's some patients that I saw, again, without getting into too many details, because, just to tell you their entire history. But we had one patient that came from maybe 4 or 5 hours away, right up on the Canadian border. And they had essentially degenerative disc disease in their spine. Not a surgical problem, but yet was on boatloads of narcotics, bunch of other medications, and also was wondering whether or not they should move forward and get a pain pump implanted. And again, I'm not here to say one thing or the other, because you have to consult with your own providers on what to do. But generally, those types of things are reserved for horrific, intractable pain where you have an amputee that is having pain that you can't control. And again, there's a million things to do before you get to that point. Or you have cancer. And it's intractable, people that are on hospice care and things like that. Why we're jumping to something like that after being on boatloads of narcotics for somebody that doesn't even have a surgical lesion, they don't have any other defined, pain other than chronic pain. They didn't have like a crush injury or something that we know is really difficult because it completely changes the way that your brain processes this. It's complicated. But again, my frustration is that a patient like that, in my opinion, not medical advice, should have never been started ever on a narcotic management. So the reason I say that is because, yes, I will agree, because some of the critics, I'm very outspoken when it comes to narcotics, and I've been attacked on social media. I had to go through this whole thing where I had to just kind of fight back all these people that were upset because I'm always looking for non-narcotic options. It's not just because of that, because the pushback on the narcotics is that there's fentanyl that's coming in, through the different borders and things like that, is the majority of the ODs. The problem is that I even see it with some of my patients. When they can't get enough narcotic, then they go on the streets looking for street drugs. I hear this all the time. Just be honest. I just hear it. And then we have to try to help them and get them into different clinics and stuff like that. But it's not just because they are getting on these high-dose medications. It's because that is robbing them of the opportunity to do these other things. Because once you start going down that route and your life is turned potentially upside down, it's very difficult for them to say, well, you're addicted to these pills and you got all this stuff and you've had all these procedures. Oh, let's do omega-3s and meditate. They're not there. All they want to know is where they can get their next pain pill. It's the only thing that they're thinking about, and that's why it's really frustrating. Yes, there is a severe, acute pain that absolutely narcotics it's a miracle, because we don't want people suicidal, because there's certain types of pain that's not tolerable. You can't. It's beyond the human. But for these other things, why is that even in? Why there are so many? And we're going to talk about some of that. How frustrating is it to see this?
Sometimes I get speechless because I look at it and I'm like, why are people doing this? And I've seen people put on narcotics for things that just don't respond to narcotics. Like, I know you as a not you as a provider, the greater you as a provider, you know that there are other options out there to put something on, put somebody on something other than just the narcotics. So why don't you start with the minimal amount? and then work your way up if you need to. But there are some things that do not respond to narcotics, and people don't think about that. Neuropathy is one. I've seen so many people come in, they're on narcotics for a neuropathy, and then in clinic I've had to work with them on how to find other options because it literally will not treat that kind of pain. So just trying to get other options out there and educating the patients that this is not your best option. Let's look at something else and transition you off of this.
No, you're absolutely right. So if you take things like peripheral neuropathy, fibromyalgia, all these other pain syndromes, what I tell people is that with certain stuff, even radicular pain it's different. I'm not saying that the narcotics don't blunt it. So what I tell them is that if we give them narcotics, for example, if they have a bad radiculopathy, and some people just need surgery, they need an injection, they need whatever, I just say that, yes, if we go the narcotic route, which we try to avoid at all costs, but if they're in severe pain, I just say it's going to blunt your pain. You're still going to have the pain. You're just not going to care as much because you're high, essentially. When people are high, they're high. They might even laugh that they're in pain. I mean, who knows? For a while, and then it's not a laughing matter when they can't find enough narcotic, to treat their pain. So I mean, you hit it right on. It is a huge problem, and the purpose of this, what we wanted to talk about today, or I'm putting Mandi on the spot, but what I wanted to talk about today is not to sit here and because we've talked about the narcotic crisis, and we could go into this. I mean, that's an entire show or 5 shows in a row. It's that there are so many options that patients are not being. It's the same thing we talk about with their overall health and well-being. We're skipping all these different steps just because it's easy. So do you think that one of the reasons that people are skipping all these steps, when I say people, I mean us as providers, why are we skipping the steps? Because you have a 7, 8, 9, supposedly the average visit is 14 minutes in the U.S. It's not 14 minutes. It's not 14 minutes. Now, again, for what we do sometimes, if we see people that if I see somebody with a disc herniation that has pain down their leg, that visit could be 2 minutes. It doesn't, because it's very simple. They need help. They're disabled and we got to do something about it. But I have chronic pain. Like, what are you going to do in 7 minutes? You can't even start their history in 7 minutes. I mean, we're just chatting for the first time. We haven't even gone anywhere. So do you think one of the big problems is just the time that we have? So everybody wants to push the easy button on both sides of the aisle, we'll call it.
Yeah, I think a time factor is in it, but I think the easy button is probably the bigger problem. Yep. And I think a lot of providers have realized that their patients don't want to put in the work a lot of the times. Not everybody. Yep. Some people are more than willing to do the work that they need to do to get better and think outside the box. But some of those patients that come in our doors don't want anything but the easy button. And so you can talk till you're blue in the face about all these other options, but then they're just going to say at the end of the day, just give me the pill. So I think a lot of people have skipped all of those other steps because there are so many patients that come in the door just wanting the easy fix.
No, absolutely, and it's interesting because everything that I'm doing and you've become a big part of is, like, I've spent the last 2 years really seeking everything that we could possibly find to help people with their pain that I have not previously thought of personally as a physician. And that's why, the oxygen therapy, the laser therapy, utilizing more acupuncturists that I refer people to, utilizing all these different techniques, which are just dramatic, utilizing a lot of anti-inflammatory, things like NAD plus and glutathione, all these other things that make it's so dramatic what we can do, but we have to look. We have to open up our minds. There's these other things, and we have to educate the public, and we have to educate our colleagues because they just don't know. Going back to the thing I just mentioned before, the laser therapy. Just to give you an example, the other day I referred 6 patients, over to get laser. 6. And I got a report on them. All 6 of them were absolutely blown away by how much pain relief they got. They could not, believe it. right? I had somebody shadowing me that also works at our wellness clinics, were shadowing me in the thing. So I said, these people were in acute pain. I said, listen, and a couple of them did absolutely need surgery. Like they're not going to get away with it. They have severe pain. But I'm like, we need something. And people are always coming in, oh, what medicines can you give me? Doctor, I need this, I need that. My primary won't prescribe me opioids. Because again, we're under a lot more scrutiny. What do I do? So I send them for this class 4 laser, and 6 out of 6 were like whatever. In fact, one their spouse was there with them, and they're like, my ankle hurts. Give me that laser, and they had a good result. And so people are doing well. That's something I didn't even have that tool 2 years ago. I didn't even know what a class 4 laser was. But you know what I wasn't doing? If somebody came in and asked me about it, I wasn't making up things one way or the other. This is great or this sucks, because I would have said, I don't know, what's a class 4 laser? Why don't you use a class 10? I don't know. Like I have no idea, but it's just we've got to do better in finding different techniques to help people with their pain, and there's so much to do.
Yeah. Yep. And I think that's a big thing right there, is just being open to all the other information that could be available for the patients to try to help them. I don't know if you've ever heard the book, The Body Keeps the Score.
Absolutely.
So I've had that book referred to me multiple times, and I have yet to read it myself. But that brings up a whole nother topic about mental health issues, because a
100%.
lot of chronic pain is related to unresolved trauma in your past and anxiety, depression. And if you treat the anxiety, depression, and you work on the trauma, you can actually decrease the chronic pain that somebody has. So, yes, sometimes there are things that they come into your office, they've got structural issues that we have an explanation for. But if you don't have a structural issue for your pain or a structural reason for it, then it could be a psychological thing that you do need the help for. And we have such a stigma around it in this country still. But if we can get past that and help our patients with those traumas and pain anxiety symptoms, it will actually help their pain.
Oh, huge! I mean, it's interesting because you bring up. I mean, I've had a bunch of people on the podcast talking about this very issue, but one that comes to mind, and he's excellent, and I would have people really read his stuff. His name is Neil Gannon. And we had a great podcast. I'm actually going to bring him back on the show because he's one of my favorites, and it's really good. But we really went into this rabbit hole of this trapped emotions. And I've talked to many other providers, and some of which have like felt like when they needed that, their emotions and their things, childhood traumas, whatever, contributed to their eventual health issues. That's a great point. It's so important to fix all those different pillars. And so when we talk about a comprehensive pain management approach, we're really talking about mental health. We're talking about, fixing your diet, fixing the way you see things, getting your stress down, getting you into parasympathetic states, and then maybe looking at some molecules. There's nonsteroidal anti-inflammatory medications. Again, we don't always have to jump to medications because there's stuff, there's all kinds of biohacking things we do. There's light therapies, there's other things. But before we get into those things, one other point that's really important, and I want you guys to listen because I really, again, both of our passion is really to help people with their pain. Pain is just devastating. It's a life ruiner. The other thing is if we look at what is happening with regulation, here's the problem. Yes, the amount of opioid prescriptions that are being given out has definitely come down. It's not come down necessarily organically. It's come down because people, are breathing down the throats of the providers and saying, you can't do this, you can't do the other thing. So here's the problem, though. So again, I don't want people to get started on it unless it's absolutely 100% indicated, okay? And that some of that stuff unfortunately still happens. But let's make it even worse now. Now there's so much scrutiny that people are being taken off of the things without a plan. That's a big problem. I see it all the time. So people come into my office crying. So first of all, they've been tanked up on all these narcotics, and now somebody's trying to wean them. The problem is the strategies behind the wean are not good. They don't incorporate any of the things we talk about, bio, all these things, like literally, like some of these things are game changers, especially to manage people's pain, but they're not being put in there. So now people are in a thing where they're seeking medications from their brother-in-law who had a surgery, 3 weeks ago and has some pills left. They're seeking whatever. They're overdosing on Tylenol and getting into liver failure. They're overdose, they're having GI issues, right? Because they're chewing ibuprofen every hour, which is not what you should be doing. Again, not medical advice because it's a radio show, but you guys got to be careful. So the reason I'm so passionate about what we're talking about on the show today is because for those of you that are listening in and tuning in, I'm just telling you, it is so important for you to see providers that are really serious about a holistic, I know it's overused, but a holistic, comprehensive pain management program. And if people are not talking about all the comprehensive things, if they're not talking to you about your nutrition, your mental health, how to work on that, they're not talking about biofeedback, they're not talking about meditation and breath work, and then going on to these different, molecules that we can use. Like I mentioned one, again, that beyond the scope of this thing, but there's something called NAD plus, which is incredible anti-inflammatory, omega-3s, a lot of other, a lot of other things that are on the market that you guys are probably aware of because this stuff is pushed. But again, you don't know how to use it in conjunction with these other things. How does it all work? One supplement from Amazon is not going to fix. It's the totality, of the whole thing. But that's why I'm so passionate about it because there are people that are listening to this radio show right now that are in pain. They don't know what to do. They're reliant on their medications. They're scared. They're being taken off of the meds or they're being forced down paths to getting these crazy things done to them, and they just don't know what to do. So my plea, if you get anything else out of what you're hearing today is find providers that really are going to take that comprehensive approach because the comprehensive approaches to pain management are amazing. I mean, with us doing the wellness centers, we have seen nothing short of miracles, except they're not really miracles. It's just people that have been exposed to things that have all kinds of scientific data behind it, and they've never heard it. They don't even know what we're talking about when we're doing. Neither they're doctors and nurse practitioners and nurses and whoever. They have no idea what we're talking about. So we need to be out there educating. What say you?
Yeah. So I'm going to throw another little thing in there. It's a good thing though. February is Preventive Health Awareness Month up in Canada, and our friend Margaret Wallace-Duffy got that going up there. She got us both as fan ambassadors, so we are both helpful on this. The big thing with that is prevention. So for anybody that's going down the road of chronic pain, preventing that chronic pain, looking at things like your diet, your nutrition, your exercise level, because once you start getting in chronic pain and your exercise starts hurting you, you're going to exercise less. But you have to keep moving so that you can keep those joints mobile, keep your muscles mobile, because if you stop moving, it's going to hurt more to try to get it back up again. So prevention is huge in medicine, and we have forgotten it on so many levels as providers that we just try to react to everything. So if you can try to prevent some of those problems, you can prevent yourself from getting down that road of chronic pain. Not to say that you're not going to have pain, but it's not going to be as severe or disabling as it could be if you stop moving and if you stop caring about what you eat.
No, absolutely. And, the other thing that I think that we definitely should bring up, and again, these are I love having radio shows and podcasts because it's good. I can vent because sometimes I just want to, in the middle of my clinic, I just want to run full speed into the wall and just knock myself out because I can't hear one more of this the nonsense that is going on. It doesn't even make any sense. And sometimes I'm upset with the people too. Obviously, I would never show that, but inside I'm like, how are you letting yourself go down this road? Do you have any accountability? Do you want to be fixed or do you this is okay, for you? But one of the things, I just want to bring up, and I know that you're going to have something to say on this. How many times do you hear, again, listen, we're not here to say we're not better than anybody else or any of that stuff, but How many times do you hear when patients talk to you, either the patient or the family is like, this is the first time anybody's actually listened to what I have to say, that has taken my problem seriously, that hasn't just wanted to, blow me off or get me out of the room or just say, here, just take this or go do that or go do whatever, right? How many times do you hear that? This is the first time. These aren't people, these are chronic pain patients. They get around.
Well, I heard it enough that people started calling me a unicorn because I would actually listen. So I started owning that little nickname, but it shouldn't be the first time that they hear or that they feel heard when they come in. But I stop, and in the chaos of clinic world and hospital world, it's really tough to stop and give everybody the time that they need sometimes. But if you stop and look at them and actually hear them, it's a whole different world than if you just keep typing on your computer while you're talking to them and you're only getting little bits and pieces because you're not getting that connection.
Absolutely.
When you literally stop and look at somebody, they're going to feel heard whether or not you actually hear what they're saying. But to actually give them that opportunity to give them a voice, it's mind-blowing. It's a whole different experience when they go into a clinic and they feel that.
And it's amazing because honestly, what you really need to do with people that have chronic pain, first of all, you have to get to the root of how much it's affecting their overall life. Sometimes they don't even know. That's why I said like 7 minutes. You can't even start a conversation on chronic pain in 7 minutes. You're just getting to like how this all starts. You're just, it takes a long time to really get to know these people, but once you really get to the heart of how much it's devastating them, then you can start outlining. Then they have somebody that say, okay, this person, kind of understands what I'm going through, whatever. So they're more apt to listen to you and say, okay, let's put together this thing. And then when it comes to the and we talk about this a lot on the show, when it comes to the investing in yourself, then when we start outlining, because sometimes they have to hear back from us, right? They tell us what's going on and we say, okay, so basically every relationship you're in is terrible. You've got fired from your job and now you're unemployed, or you're not doing well at work, or you thought you were going to get that, but you're hampered by your chronic pain, scenario. You are completely addicted to your medications. Or how about for your every waking hour, all you think about is your problems. That's not a good place to be, right? You want to be enjoying your life and doing those things. So once you frame it like that for them, then you can start outlining, well, what are our goals? Right? What if we could reduce your pain by 50% by doing these things, which are non-medication and non-procedure, all of a sudden, and then you say, well, what would that do with your relationship with your son? How would that help you with this, with that? Once you start framing it that way, then you have a framework. You cannot, these people, they need general frameworks, and their framework should not be, what class of medications do I need to switch from this to that? That's awful. We've gone down that. It's become so transactional. It's very bothersome. And that's why, like I said a million times on the show, that's why I had to get into that integrative health space. Because when I see patients there in the integrative health model, or even other people see them and then they talk to me when I'm just there at the clinic or something like that, it's such a more like robust experience for everybody, and it's so much more satisfying, and it's nice to know that you could be really part of somebody's life, and help them through those things. I mean, isn't it like how important it is for us? Like, we need to know you cannot treat chronic pain, especially with all the mental health components, whatever, unless you know that you have to know that person. You cannot know them in a 14-minute video. You can't. So for you guys listening, you got to seek care in places that have very holistic, comprehensive things. Again, it's advice. It's not medical advice, but I can tell you, you're going to do a lot better going that way. And I'm trying to protect you from going into really bad places. I mean, anything to add to that?
Yeah, no. The only thing I was going to say is that if you try to understand why it's important to really understand our patients, it's like with surgery. You have to know your anatomy. You have to know exactly what part of that body that the patient's symptoms are coming from and what thing you need to do your surgery on. In order to treat a patient correctly with medications, with anything for a chronic pain thing, you have to understand the anatomy of their pain. So to understand the anatomy of their pain, you need to know all of the details. If you don't have all the details, you might be doing surgery on the wrong part of their body.
No, absolutely. You're absolutely right. I love that phrase, the anatomy of their pain. That's exactly right. You can't draw out their anatomical map because it's not a generic map. It's not like, oh, you know what? It's a good thing I have my cheat sheet here, so we'll do that. You can't do that. Everybody has their own map, and you really have to dig. And you mentioned it before when you talk about pain maps. Some of that is the trend. I know it's like people are like, oh, here we go again with the touchy-feely spine guy, right? But seriously, like these emotions, people have, it might. This is just going to sound whatever, but there's like hard science behind this. Trust me, otherwise I wouldn't be. But people have childhood traumas and experiences, or we all know, people that have been in abusive situations respond differently to pain. Their brain works differently because they've changed their pleasure reward center. It's a whole science behind it that we could do a whole neuroscience thing, and you could take the lead on that because you're the neuroscientist. But honestly, like it's such a and you can't do that unless you outline it. So you do have to ask people, did this happen to you? Were you abused? They're going to be totally different, and they're going to be much more likely to have addictive personalities where, you can get into a lot of trouble when you do down different paths. But if you're just writing, just coming in, just writing a script for everyone like it's the same, not to mention the genetic changes and the other things, because honestly, there's all these tests you can do to see how you're genetically you process pain medication, and that can, help us to manage. And there's some ethical, people are worried about that. There's something called the GARS test it's not available commercially now, but it tells you your genetic assessment risk score was developed by this Dr. Bloom. I love that, right? Because if providers know if this person gets started on it, they have no chance. Like they'll be seeking like they'll think about nothing else. So that only if they're gonna need like their leg has to be cut off, or you're gonna put them on narcotics. Don't get mad at me. I don't want to hear anything on the social media. The guy I was labeled as the anti-narcotic spine surgeon, and people were saying I was doing surgery without narcotics, and like that's not what we do. I don't do that, but I am very passionate about these other options, which let's run through some of them now. Whatever, I have them, but in me, I ramble. So I have it. I wrote it down just so whatever. So let's just talk about like the very, very simple overview. Mind-body connection, massive. Meditation. We've talked about meditation on the show. You literally can think yourself well. Literally. This is science. I'm not making it up. Mindfulness, right? There's all kinds of mindfulness classes. And actually, some of the really big institutions have all kinds of mindfulness programs. If you look at Cleveland Clinic, if you look at some of these other places, it's very, very important. We can have an entire show on mindfulness. Yoga, Tai Chi, these things where you really are focusing on your breath, you're focusing on your body posture, movements, things like that. The reason it's been around for centuries and centuries is because it actually works and it keeps people healthy. Because you know what? There was a time we didn't have medicines that we could give people. But they seemed to, other than infectious diseases, if you didn't get an infectious disease, people were fine. They weren't getting diabetes and, depression and heart attacks. That just wasn't a thing. It was so rare, before. So mind-body connection, nutrition, another entire show. Anti-inflammatory diets like the Amy Myers anti-inflammatory, intermittent fasting, vegan, right? Some people, I'm not going to get into the controversy of the whole carnivore diet because, again, it's great for weight loss. It may not be the best for longevity. We can talk about that. I think we've talked about it enough, but we could get into it. Acupuncture, things like acupuncture, massage therapy. People really do enjoy these things, but again, it gets completely downplayed by our colleagues. Oh, you need medicine. That's not going to do anything, right? And again, listen, they've done all these like sham acupuncture studies and everything like that. The bottom line is if it works for people, you know what acupuncture is not doing? It's not killing anyone. So everybody take a deep breath. It's okay. People are not dying from acupuncture and massage therapy. They are dying of overdoses, though. They are dying of and they're dying of chronic diseases, some of which are getting worse because you're taking all these medicines, a vicious cycle, i.e. diabetes, right? And its management. Then then we could talk about biohacking, the biohacking stuff, red light therapy, right? There is oxygen therapy. Hyperbaric chambers have been studied for a long, long time. We do exercise while under oxygen. There's pulsed electromagnetic frequency. There's there's ozone therapies. There's all kinds of stuff. You guys do your own research, but there's so many things. Like if you look at light therapies, one of the things I'll bring up, which we love, like at our centers, is green light, because it releases your own body's endorphins. This has been heavily studied at the University of Arizona. They've done studies on fibromyalgia and migraine with amazing benefits. They're studying post-surgical care now with green light. We have had amazing results at our clinics utilizing green light for pain. But yet, if you say like green light, people don't even know what red light is. I say green light to my colleagues, and They think like we're, oh, do you turn into the Hulk in there or something? Like, what do you mean green light? Is this like a Marvel Comics thing? It's just like no idea. So we're out here teaching. Then there's like the IV infusions, NAD, glutathione. There's all kinds of IV vitamin drips. If you just look at the anti-inflammatory effects of like vitamin B, right, getting your vitamin D levels, all these things, if those are off, you're not gonna be your best. Then really quickly, there's a class of medications that kind of slows down your nerve conduction, that PBOK, then that's like the Neurontins and the gabapentins of the world. It's not great for your brain function, so it's like it's other things. There's topical agents, there's anti-inflammatories. We can't get into all this because, again, each of them is its own thing. But just from what I said, there's all these other different options. And we didn't even talk about counseling. We didn't talk about being part of groups where people talk about their chronic pain. Off the top of our heads, we could just like spew out like all these things that have there's these patches that are common that again I can't go into. The narcotics we've kind of talked about ad nauseum, and then you have procedures that that we can do, like for example in spine, like you could do like radio frequency ablations, and you could do other things where you're not really creating a lot of damage, but you really help patients non-surgically and things like that. Then you can get more aggressive, right? Then there's spinal cord stimulators, which basically are these little devices that are implanted in your spinal cord. They can block the pain from going to your brain. That really should be reserved for more serious situations. Talk to your doctor or your healthcare provider about that. And then the pain pumps, which again, I've given my opinion on pain pumps. We need more time for that. And then I'll just close, just to give you guys ideas of what's out there. There's regenerative medicine options. One of the biggest things that is disabling our population, back pain, neck pain, but osteoarthritis. People are just devastated with knee and hip pain. Not everybody, and ankles and wrists, all kinds of things get arthritic, right? And shoulders. Not everybody wants to have surgery or needs surgery. So there are all these options in the stem cell world and the regenerative medicine where you can take your own cells, put them back into you with amazing results. Another thing that people were coming to me for years saying, oh, I'm going down to Colombia, I'm going to Ecuador, I'm going to Puerto Rico, I'm going to all these places to get my stem cells. And I kind of blew it off. That's fringe medicine, that's this, that's that. And here we are, we're doing it because it has amazing data and it's your cells. So you're not going to reject them. They're yours. It's like it makes no sense that people are not being offered this, and they're getting they're giving them pain pumps. It's insane. I just gave a whole list of all these things we can do, and we didn't even get into it. So am I missing anything? I tried to list it out to be pretty comprehensive, but
there's nothing else I can think of off the top of my head. You did a good job with that list. I'm impressed.
Thanks. I just want to, because I'm very verbose, so I just want to make sure, I get it. So, in closing for this segment, and I'll let you. Sorry, I cut into Mandi's time. I do that a little bit. She's told. Don't believe me. It's not like she hasn't told me. But she gets a lot of, you get a lot of the episodes on your own. So it's not.
It's all good.
It's all good. We'll just whatever. So on the other side of the break, we'll close it down. I'm just curious to know, like, Mandi's overall thoughts on what her recommendations are for people, how they can get really going down the right treatment path. Because as we've talked about in the show, when you start getting into pain, where you start in the process is going to make a dramatic difference into your overall long-term outcome. And if you get into a situation where you have, right, you're just spinning, you're just like one foot on a banana peel, the other foot in the grave, it's not a good place to be. So let's not get there. Let's start it off right and go to people. And if you are having chronic pain, you got to find the right people to help you with it, because there's so many things to help you. We'll see you on the other side of the break. This is AM 950 Radio, recharging the human battery. See you in a minute. All right, we're back on Recharging the Human Battery Radio. I'm Dr. Sinacropi, joined by my Mandi Dickey, and we're pretty fired up. And as always, when we do these things, we just realize that we really need 2 hours, because otherwise we have to zip through topic. Because we bring up one thing, and we're off to the races on another thing, and hopefully you guys got a lot out of it. How I wanted to close this show, I just wanted to have Mandi talk about from a different perspective, because you guys know how I feel, and I might be too excited right now to give you the recommendations exactly the way I want to, because I see so much that is problematic, and I feel so bad for people that go down the wrong path. So how can people get on the right track to managing their pain? How do we frame this so that they know what to do and where to go?
Yeah, so I think first off, I'll tell you a little bit about what I do when I'm in clinic. When I see people, the first thing that I look at is natural things that we can do, nutritional things, diet, looking at their diet, looking at their exercise, looking at their daily activities, figuring out what their day looks like. And then we check some vitamins. We talk about the simple vitamins that sometimes that's all people need to get on the right track. And this is from years of dealing with people with chronic neurological pain and migraines. Sometimes vitamins and some diet nutrition was all we needed to do. So there are times when it's really just that simple. And I know people don't ever want to think that something can be that simple, but if you're looking for the easy button, take the easy button that's going to be a little bit healthier for you. And beyond that, then we were looking at the psychological part of it, because again, in the neurological world, there's a very fine line between psych and neuro. So your brain it's all one big happy family up there. So when we're talking about neurological problems, sometimes it's not so happy.
The pain people, the happiness. We want it to be a happy family. Mandy's really a glass half full today. I love it.
All those nerves are connected. So if you have those chronic traumatic issues that you have to deal with, that's going to lead to a lot of pain, like we already talked about on the show here. So that's always one of the next steps that I talk about is do not let that stigma prevent you from getting the care that you need, because that literally can be a game changer, a life changer for you. So that's the next thing that we do. And then it was always talking about, well, where else can I send you to get more information? And I gave lots of options, and functional medicine, and integrative medicine, and then, yes, our traditional routes. You can choose any or all of the above. The more tools you have in your toolbox, the better you are. I just did a podcast interview with somebody the other day that said if you open up your toolbox and all you have is a screwdriver, you cannot fix everything. So you have to have all of the tools in the toolbox. So offering up all of those different options that where you can go for a referral. Do I have a preference on one or the other? Sure. Am I going to tell you that? No, because that's not my place. But just giving you all of the options and then letting you choose, because again, as we've said many times, you are the CEO of your own healthcare. You have to take charge of this. You have more responsibility in your own health than you realize. Your choices on a day-to-day basis will make or break whether or not you have chronic pain or not, to tell the truth, because you have so much control over that. We don't often take that control. We don't realize we have that control. So just having somebody tell you that sometimes is an aha moment enough for people to realize, oh yeah, I can do something about this. And I would give them the options of things that I could help them with. And then I would tell them, beyond this, this is what you can do for yourself, because they have to know all of the options. So you as a provider, you the general, you out there listening, you as the patient, you have to think about all of those things and where you have your responsibility. And if you're not getting the answers that you want, you need to seek other answers from other people, because not everybody's going to have all the answers for you.
100%. That was well said. And I love it's when you empower people to do something. Almost every pain situation, if people are empowered, they can get better. Period. We believe that. We believe in you. We see it. And sometimes people haven't believed in them. It's also about us believing in you that you can do it, but you need to believe in yourself. You need to be the CEO of your own health. And when we empower you, you feel like you can make a difference. It's when people feel like there is no hope, there's nothing to do. They just give up, and they literally do everything the opposite of what they should do. So on that note, hopefully you've enjoyed this episode of Recharging the Human Battery. We're on AM 950 Radio. Cinecropy and Mandi Dickey, we are out. We'll see you next week.